Welcome back to the Morning Blend. There are many reasons a woman may want a breast enhancement, but it can be hard to openly discuss without judgment. So joining us now with some of the most advanced breast augmentation options is plastic surgeon Dr. Colque. We're also going to talk a little bit about commonly asked questions, which is, I think, really important. Great to see you.
Good to see you. Thank you.
Let's talk a little bit about breast augmentation. I know from being at an event at Skin that it's a very common one of the most common nationwide procedures for a woman to have, right?
That's right. It is the most common cosmetics procedure done in the country, the most common cosmetic surgery. By far, it's much more common than all of the other procedures that we perform.
Well, what do you identify as maybe the main reason that women want this particular procedure?
Well, the most common patient is a woman that has, had children, lost some of her shape due to aging or pregnancy, and wants to regain some of her more youthful breast appearance.
I would think a lot of what you do is the consultation part of it, where you kind of discuss a little bit what they're looking for, what's maybe realistic or maybe appropriate for their body frame, their size.
Right. There's a lot that goes into the consultation. I personally do a lot of listening to see what their desires are, and then there's a lot of different measurements and things we talk about during the consultation to make sure that we get an implant that will fit the patient very well. And
their desired result. New advances is one of the things that we want to talk about, and you actually brought some examples of implants. Talk to us about what you brought and what's new about it.
Right, so the implant you see on the right-hand side is the...
Okay, so is that this one?
That's this one. It's the more standard implant, and you can see how it has almost a little dip to it.
Right at the top?
That's right.
Yep.
And the new implant there on the left-hand side, yep, has a greater fill volume, so it has less of that dip, a greater fill volume to shell ratio, so it gives more full. It gives a more full appearance, more upper pole fullness, a little bit more cleavage that a lot of patients are seeking out.
Now, are the two below it the same? Are they the exact same type of implant?
So the two below it are also they're just a little bit different shape, a little bit flatter and wider of an implant, but also one is the standard one is on the lower shelf, and then on the higher shelf is the more advanced, the newer implant.
And doctor, do you sometimes use these in reconstructive surgery too if someone's had breast cancer?
Absolutely, very commonly, and the newer implants are the Inspirers that are new available are becoming more common with that because they do have more of a fill volume, and when someone has lost their breast tissue, that can become more advantageous.
More important probably too. In terms of most commonly asked questions, what do patients want to know, or what do they ask as part of the consultation?
Right. So the two most common questions are, what are my options? They want to know all of the options that they'll have, and then the other one is how long is the recuperation, and what is the recuperation like?
What is that like?
So the recuperation tends to be pretty well tolerated. Most patients are, back to doing their just basic activity in a couple of days. I've had several patients that have gone back to work in just 2 days after the procedure. Patients will have the procedure on a Friday and go back to work on a Monday or Tuesday, and that's very common and very well within the average.
Do people ask about the safety of implants as well?
They do, and the implants today are safer than they've ever been before. They're more of a cohesive gel, so they don't leak out like they used to. You can cut these implants in half, and they won't leak out. They'll kind of take more of the shape of a gummy bear.
Wow, and as we look at a photograph, you mentioned fill volume, which is an expression I've never heard before, as well as cleavage. So kind of depending on what somebody's looking for, those are all things you can discuss and try to create for them.
That's right. Depending on what someone's looking for, a more round, more full look, they might be a better candidate for the new Inspire implants, whereas someone that's looking for a little bit more, natural appearing teardrop shape look, then the more standard implant might be a better choice. So now with the new Inspire implants, we just have more options.
It's wonderful. Last time you were here, I remember talking about CoolSculpting of the neck in particular, and a lot of people were asking about it at the event I attended with you, where I got to meet a lot of your very happy patients, as well as people who were looking for new skincare products.
All right, thank you. The last time we talked about our new CoolSculpting applicator for the neck, and as you can see from some of these photos, the results have just been really outstanding, and even I've been surprised at the amount of retraction and improvement of the contour of the neck that we've had.
Well, and don't you feel, even looking at some of those photographs, that it truly changes somebody's profile? And a lot of people, it's not that they're overweight, it's just that the way their body is, this under the chin area is structured.
It changes their profile, it changes the appearance of their face to give them more youthful appearance, and all of that without any incisions, without any injections, without any of the risks of multiple injections and swelling and nerve risks, all with just no incisions, no downtime, a complete non-invasive procedure.
Because CoolSculpting has to do with freezing the fat and then your body eliminates it, so you're not making any cuts. It's not a surgery.
That's right.
It's wonderful technology for people to ask about and find out more about. But I want to start by talking about this breast augmentation options event that you have coming up. It's actually happening this week on Thursday, February 25th. So you can find out more. You must RSVP, but a wonderful time to ask some great questions about breast augmentation. It's from 6 until 7:30 p.m. There's no cost to attend. You just want to know how many people are going to be there.
Right.
So people should call your office. It's Dr. Alex Colque Plastic Surgery. You can go to acplasticsurgery.com. And here's that phone number to RSVP for Thursday night's event. It is 262-781-9000. Always great to see you. Thank you so much.
Oh, thanks for having me. I appreciate it.
Appreciate your time.